You know, what really surprises me as a doctor isn't that older men have questions about their sexual health. It's that so many are too embarrassed to even ask. I've treated veterans, retired business leaders, men who've been married for decades, fellows who've faced all kinds of challenges in life. But when it comes to this one simple question, they whisper it like it's some kind of sin. Dr. Langley, is it all right for me to still be masturbating at my age? Well, let me tell you something that might just surprise you. Everything you've heard about getting older, about desire, and about what's appropriate after you turn 60, a lot of it is just plain wrong. And that misinformation isn't just confusing, it's actually harmful. I'm Dr. Edward Langley, and I've been a professor of urology and men's health expert for over 30 years now. I've worked with thousands of men in their 60s, 70s, and even their 80s. And I can tell you, your sexuality doesn't just shut down as you get older, it just changes. But here's the strange thing. While society often tells older men to keep quiet about their desires, science is telling us something completely different. What if I told you that masturbation later in life isn't just safe? It might actually be one of the smartest, healthiest things you can do for your heart, your prostate, your brain, and even your immune system. Today, I'm going to go through the research and share some real-world clinical insights to help you understand the truth about your own body. No shame, no judgment, just clear, honest answers. And later on, I'll even tell you about one hidden sign that might mean your solo habits are pointing to something deeper. This is about taking care of your health, not apologizing for it. So, let's get started. Now, before we dive in, if you haven't already, I encourage you to subscribe to this channel and turn on notifications so you don't miss out on honest, science-based health advice made just for men in their golden years. And if this topic is important to you, type 1 in the comments. If not, type 0. I read every single response, and it helps me create content that truly supports your health and your life. Let's start with the basics. Understanding how your body changes as you age and what that really means for your sexual health. Because before we can talk about whether masturbation is healthy, we need to be clear on what's normal, what's not, and why you shouldn't feel ashamed of your desires. First, let's talk about the aging body and what really happens to your sexual health. When I first started practicing medicine, I thought the hardest part of my job would be diagnosing complex conditions or doing delicate procedures. But I quickly realized that something else was even harder: getting older men to talk openly about what's happening with their bodies, especially when it comes to sex. I've had so many men in their 60s, 70s, and beyond sit across from me, clearly uncomfortable, struggling to ask a very human question: is what I'm going through normal? And let me tell you, yes, it is. As we get older, one of the most predictable changes in the male body is a gradual decline in testosterone. Starting around age 30, men lose about 1% of their testosterone each year. By the time you're in your 60s or 70s, that adds up. But testosterone isn't just about your sex drive. It also affects your energy levels, your mood, your strength, and yes, your sexual performance. That's where a lot of men start to worry. Erections take longer. They're not as firm. It might take more time or more stimulation to reach orgasm. And the recovery period after sexual activity, that takes longer too. For some men, these changes feel like a personal failing. But I'm here to tell you, what you're experiencing isn't a failure. It's just how your body works. It's not broken, it's just different. What really breaks my heart is how many men suffer in silence. They think they're alone. They think something's wrong with them. They think they're less of a man because their body has changed. But let me assure you, the desire for intimacy, for connection, for pleasure, those things don't just disappear as you get older. In fact, for many men, those desires actually become stronger. You just have to learn how to work with the changes, not against them. Your body may be aging, yes, but it's still capable, still responsive, still deserving of attention, care, and even pleasure. And the moment you start seeing your sexuality not as something you've lost, but as something that's evolving, that's the moment you start to reclaim it. Now that you understand what's happening on the inside, let's tackle one of the most common myths out there. Is sexual activity, especially masturbation, dangerous for your heart? The answer might surprise you. Next, let's talk about heart health and debunk that danger myth. Over the years, one of the most common fears I've heard from my older male patients, good honest men who want to stay healthy, is this: Dr. Langley, isn't sex too risky for my heart at my age? And many of them lump masturbation into that fear, as if any sexual activity could suddenly trigger something dangerous. I understand why. The idea of having a heart attack during sex is scary. We've all seen those headlines: man in his 70s dies in bed. The media loves those stories. But here's what the science and decades of cardiology research actually tell us. For most men in decent health, sexual activity is about as strenuous as climbing 2 flights of stairs. That's it. If you can do that without chest pain, shortness of breath, or dizziness, your heart can handle sex, including masturbation. In fact, regular sexual activity, whether you're with a partner or on your own, might actually protect your heart. I've seen this time and again, both in research and with my own patients. A major study published in the American Journal of Cardiology followed over 1,000 men for 16 years. It found that those who had sex less than once a month had a 45% higher risk of developing heart disease than those who had sex twice a week or more. Why is that? Because orgasm is more than just a moment of pleasure. It's a full-body experience. Your heart rate increases, your blood vessels widen, and afterward, your body releases calming hormones that help regulate your blood pressure and lower your stress levels. Masturbation, in particular, offers these cardiovascular benefits without the added pressure or performance anxiety that some older men feel during sex with a partner. It's a safe, self-paced, and natural way to keep your heart engaged, both literally and figuratively. But beyond blood flow and heartbeats, there's something deeply emotional about this. Many older men, after suffering heart scares or being diagnosed with conditions like hypertension or arrhythmia, give up on sex altogether. Not because they want to, but because they're afraid. And that fear creates isolation. But fear, when it's not based on facts, steals your joy, your connection, and your confidence. You deserve more than that. So, if your heart can handle a brisk walk, chances are it can handle intimacy. And once you know that, it opens the door to a bigger question. How does all of this connect to one of the most overlooked parts of a man's body as he gets older, the prostate? What I'm about to share next might completely change how you view self-care. Now, let's talk about prostate health and a natural kind of maintenance you might not know you needed. If there's one topic older men don't bring up often enough, unless they absolutely have to, it's the prostate. And I understand why. It's a part of the body most of us never think about until it starts causing problems. But here's what I want you to know. The prostate isn't just some small, silent gland buried deep inside your pelvis. It plays a central role in your sexual and urinary health. And taking care of it becomes even more important as you get older. By the time most men reach their 60s or 70s, the prostate naturally begins to enlarge. We call this benign prostatic hyperplasia, or BPH. It's not cancerous, but it can make life miserable. Frequent urination, a weak stream, that frustrating feeling that you can't quite empty your bladder, and waking up 2 or 3 times a night just to use the bathroom. It wears you down. It affects your sleep, your mood, even your confidence. Now, here's the part that surprises many of my patients. Regular ejaculation, including through masturbation, can actually help support prostate health. Yes, you heard that right. When you ejaculate, you're not just releasing semen, you're also clearing out built-up fluids in the prostate. That release improves circulation in the area and helps reduce inflammation, which may ease some of the symptoms associated with BPH. A study out of Harvard found that men who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer compared to those who did so only a few times. While that number might seem high, the point is clear. Use it or lose it applies here in a very real, very physical way. The prostate was designed to be active. Letting it sit idle isn't doing you any favors. And I've seen it firsthand. Men who maintain a healthy sexual routine, including regular solo activity, often report better urinary flow, fewer symptoms, and a greater sense of control over their health. They feel more connected to their bodies and less like a passenger on a ride they can't steer. But beyond your prostate, there's something even more powerful happening during sexual activity. Something you can't see, but you can definitely feel. It's what goes on inside your brain, and the impact it has might just surprise you.
Let's take a closer look.
Now, let's consider mental health, hormones, and the brain. There's something remarkable that happens in a man's brain during sexual release, something I wish more people understood, especially as we get older. I've had patients in their 70s tell me, "Doc, it's not even about the sex anymore. It's about feeling normal, feeling like myself again, even if just for a little while."
And you know what?
That feeling is rooted in real, measurable brain chemistry. When you orgasm, whether through sex or masturbation, your brain releases a cascade of powerful neurochemicals. Dopamine floods your system, giving you a rush of pleasure and motivation. Oxytocin, often called the bonding hormone, helps reduce anxiety and fosters a sense of calm and connection, even when you're alone. Endorphins ease physical discomfort, and prolactin helps your body relax and transition into rest. It's not just emotional, it's biological. Your brain is built for this. As we get older, these chemical benefits become even more essential. Older adults are more vulnerable to depression, loneliness, and sleep problems. I've had widowers tell me they felt disconnected from the world until they gave themselves permission to feel pleasure again.
And what happened?
They began sleeping better. They felt more stable, less irritable. They started reconnecting with themselves and eventually with others. There's even growing evidence that regular sexual activity may help preserve cognitive function. One study published in the Archives of Sexual Behavior found that older adults who remained sexually active performed better on memory tests.
That's not a coincidence.
A stimulated brain, one that experiences pleasure, connection, and release, is a healthier brain. And when you combine that with the emotional clarity and confidence that comes from honoring your body's needs, it becomes clear that masturbation isn't just about release, it's about mental resilience. You see, sexual health is deeply intertwined with emotional well-being. When men deny themselves pleasure, they're often denying themselves peace. But when they allow space for intimacy, even solo, they often rediscover a part of themselves that was never gone, just buried under years of guilt or misinformation. And while all this might seem like more than enough reason to embrace this part of life, we're not done yet. Because what if I told you that regular sexual activity could also strengthen your immune system in ways you never imagined? Let's talk about that next. Now, let's consider immunity and a natural boost you might not expect. This might surprise you, but one of the most overlooked benefits of regular sexual activity, including masturbation, is its effect on the immune system.
It sounds almost too good to be true.
After all, we usually think of immune strength coming from things like diet, exercise, or vitamins. But pleasure? Most people never make that connection. And yet, science is showing us it's very real. Back when I first read the research, I'll admit I raised an eyebrow. A study out of Wilkes University found that people who had sexual activity once or twice a week had significantly higher levels of immunoglobulin A or IgA, which is a key antibody that plays a crucial role in fighting off infections. We're talking about a 30% increase in IgA levels. That's a meaningful boost, especially for older adults whose immune systems naturally become less efficient over time. Think about that for a second. Something as natural and accessible as self-pleasure, practiced regularly and without shame, might actually help your body defend itself against colds, viruses, and more serious illnesses. There's something powerful, almost poetic about that. In taking care of your emotional and sexual needs, you may also be strengthening your physical defenses. And this isn't just about antibodies. Regular sexual activity has been linked to lower levels of cortisol, the stress hormone. And when stress levels drop, your immune function typically improves. I've seen this play out in real life too. Men who stay sexually active often report feeling more energized, less anxious, and even getting sick less frequently. There's a deeper message here, one I've shared with many of my patients. When you treat your pleasure as a legitimate part of your health, not something shameful or silly, you begin to care for yourself in a more complete way. It's not indulgence, it's maintenance, just like eating well or getting your steps in. Now, by this point, you might be wondering, if all of this is true, if masturbation is safe, natural, and even beneficial, why do so many men still feel ashamed or uncertain about it? Well, it's time we talk about the myths, the outdated, dangerous beliefs that have been holding men back for generations. And some of them may be things you've believed for most of your life. Let's clear them up once and for all. Now, let's get into myth-busting and correct some common fears and misconceptions. After all the science, the studies, and the real-world stories from my years in practice, one thing still frustrates me deeply: how many good men continue to suffer in silence because of myths they've been told all their lives. Myths that make them feel ashamed of their bodies, doubtful of their instincts, or even afraid of something as natural as masturbation. These beliefs don't come from medicine, they come from misinformation, cultural stigma, and outdated thinking. And it's time we talk about them head-on. One of the most damaging myths is this idea that men become too old for sexual activity. I hear it all the time: Dr. Langley, maybe I should just let it go. I'm 70 now. Isn't it time I moved on from all that? My answer is always the same: moved on from what?
From being human?
From feeling pleasure. Age doesn't take away your right to connect with your body, it simply changes how that connection looks. Another myth is the belief that it's not normal, that older men don't masturbate or shouldn't. But the truth is, research shows that over 40% of men over 65 do engage in regular masturbation. That's not weird, that's not broken, that's normal. And that number might even be higher if more men felt safe enough to admit it. Then there's the fear that masturbation will somehow worsen medical conditions like diabetes, heart disease, or high blood pressure. But for the vast majority of men, the opposite is true. Regular sexual activity is associated with lower stress, better sleep, healthier hormone balance, and improved cardiovascular function. Of course, if you have a serious condition, talk to your doctor, but don't assume pleasure is off limits. And finally, I often hear this: I should save my energy for more important things. But what could be more important than your mental clarity, emotional peace, and physical well-being? Masturbation isn't a waste of energy, it's a way of restoring it. So, if you've been carrying guilt, doubt, or hesitation about your sexuality as you age, I hope you're beginning to let that go, because the truth is freeing. And now that we've broken through the myths, it's time to bring everything together. In this final segment, I'll give you the bottom line, clear, direct, and from the heart.
Let's finish strong.
Now, let's get to the bottom line, clear, direct, and from the heart. So, here we are, after walking through the science, the stories, and the truth that so many men have waited years, sometimes decades, to hear. If you've made it this far, I want to thank you, not just for watching, but for showing up for yourself. Because this conversation isn't really about sex, it's about health. It's about dignity. It's about reclaiming a part of yourself that you may have been taught to silence. We've talked about how your body changes with age, how erections may feel different, how recovery takes longer, how desire evolves but doesn't disappear. We've broken down the myth that masturbation is dangerous for your heart and instead revealed that it may protect it. We've explored how regular sexual activity can support prostate health, sharpen your mind, boost your immune system, and lift your mood. And we've tackled the myths, those quiet lies that make too many good men feel like they're doing something wrong when they're simply being human. As a doctor, and more importantly as a fellow man, let me say this clearly: you do not need permission to care for yourself. You do not need to feel shame for being alive in your body. Your sexuality is not a relic of your youth. It's a thread that ties into your wellness, your identity, and your sense of wholeness. You've spent your life caring for others. It's okay to care for yourself. That's not selfish, that's healthy. And now you finally have the truth to make that choice with confidence.